With tens of thousands of new coronavirus cases being reported in California each week, it might seem inevitable that everyone will get infected at some point. But that's not necessarily the case, officials and experts say. Even with the near-constant drumbeat of transmission this spring and summer, millions of Californians have still been able to avoid catching the virus. For some, that might be a matter of circumstance. Their work or living situations allow them to rarely venture into crowded settings. Others may still be avoiding non-essential activities to lessen their exposure risk. Many might chalk it up to luck. The storyline is, everybody's gotten it. But the reality is a lot of people haven't, said Dr. Peter Chin-Hong, a UC San Francisco infectious disease expert. While there's no silver bullet, residents can still take reasonable precautions to lessen their chance of getting infected. Everyone needs to be vigilant to avoid exposure and prevent severe disease, especially during periods of high community transmission, said Dr. Robert Kim-Farley, an epidemiologist. Getting vaccinated and boosted remains one of the best ways to stave off infection, and especially to avoid the most serious health impacts of COVID-19, officials and experts say. The vaccines are, in fact, doing exactly what we need them to do. They're preventing severe illness and death, Los Angeles County Public Health Director Barbara Ferrer said. I want folks to feel confident that their actions are making a difference, she said Tuesday during a presentation to the They protect our entire community from the worst impacts of the pandemic. According to the latest state data, unvaccinated Californians were 5 times more likely to get COVID-19 than their vaccinated and boosted counterparts. They also were 8 times more likely to be hospitalized with COVID-19, as well as to die from the disease. Some of the new things that are keeping transmissions at bay potentially are the fact that kids now under 5 are getting vaccinated, kids 5 and over can get a booster, there's more Paxlovid G. All of that might keep community viral load lower than it would have been, Chin-Hong said. But although most Californians have already completed their primary vaccine series, demand for boosters has been lower. Vaccination rates for children ages 5 to 11 have also lagged well behind other age groups, and the youngest children only just became eligible for the shots. The fact that vaccine protection wanes over time underscores the importance of staying up to date on the shots, experts say. According to research published this month in the New England Journal of Medicine, 2 shots of COVID-19 vaccine without an additional booster offer essentially no lasting protection against infection with Omicron.